it can be difficult to kind of pinpoint in this community. And the reason I say that is because reckless behavior sort of goes with the territory. So when Tom and I would go and speak at different bases, we had the colonel one time say, listen, can you go through the signs and symptoms? And I said, I can, but it's going to look like every single person in this room. And it's going to be real hard for somebody to say, they drink excessively, and everyone looking left and right is going to go, yep. Yeah. Anger issues or rage. Yep. Lack of sleep. Yep. So in this community, it can be really difficult because so many of these signs and symptoms look quote unquote normal, or this is just how we do, or this is how we manage. What I will say is spouses, family members know their loved one. They know that person. So what you want to look for is change. So isolating is a big thing to kind of start to get worried about. Any behavioral changes, starting drinking, stopping drinking, reckless behaviors with affairs, maybe reuniting with old flames on Facebook, things like that. That's a sign that somebody's trying to cope with the trauma instead of face the trauma. And where it gets dangerous, I believe, and what we know statistically, is when alcohol and drugs become involved. For sure. Because in the veteran community, it's about 89% of the suicides are happening when the service member is severely intoxicated. Yeah. So if alcohol is at play, that's something to be really concerned about with PTS. It's the two don't mix together very well.